Anyway, for right now, are there any questions? You're open. The floor is open for questions.
I have one regarding vaccines. I think you mentioned that you would say something about vaccines. I'd like to address that, please.
You're asking for question on vaccines?
Vaccines, he said he was one. I thought it was on the slide that it would address vaccines.
Okay.
Yeah, there was one that said vaccine. I kind of jumped quickly because of time, but just on a general note, just to mention, vaccines were developed years and years ago when epidemic started, when people started, some infections would go around and spread from one person to the next, especially viral infections, and people were dying. So they were trying to figure out what they could do. They couldn't come up with medications to treat those viruses quickly. And many people were losing parents and spouses and children. And vaccines, somebody came up with the vaccine where they pretty much said, hey, how can we expose you to a mild form or a weakened version of this thing causing the infection to prepare your body so that if you get exposed to the main thing, your body is ready to fight? Because naturally, God has blessed us with this immunity, both natural and active immunity that we have, so that when we are exposed to certain infections, your body fights immediately, mounts a response. Sometimes different people mount responses in different ways, but some people, it takes them a while to develop some of that immunity to be able to mount a good response. So they felt by exposing you to a weakened form of that infection causing the epidemic or the pandemic, that they would prepare your body so that if you do come in contact with the main thing, you're better prepared to face it, and you have a better chance to fight the infection. So overall, that's what I'll tell you about vaccines. And now there are so many questions about vaccines. If I go into vaccines, I won't exhaust, but I want to address specific questions on vaccine that you would want answered. And I'm not a vaccine specialist, but I do understand vaccines, and I can tell you as much as possible,
Linda, was your question probably related to the current
pandemic?
COVID.
Yeah, the COVID. Yeah.
Okay.
Kind of, but I didn't want to kind of go there. I was concerned because it's still experimental, that new technology with the mRNA. I'm not quite sure. Can it be harmful to our bodies, that technology?
Okay. So can you hear me?
Yes, we can. Thank you.
Okay, so you're completely right, and your concerns are legit and it's validated. I had my concerns even as a physician, and the reason I had my concerns is it's a new technology. And we just haven't had enough time to be able to tell you much about it, because again, you have to understand, this was produced in a hurry because people were dying in millions all over the world. So, we don't know enough about it. But then some of the concerns, I'll tell you some of the concerns I've heard out there, and I'll tell you some of the concerns that I had myself as a physician. I've had concerns that, hey, it's mRNA, so it's a genetic material. Can it change your DNA? Can it change who you are? I've had concerns about, hey, what if it causes autoimmunity where your body starts attacking itself? I've heard, what if there is a chip technology to monitor you? I've heard that concern. I've heard, hey, what if this is the mark of the beast, the 666? I've heard that also. I will address the ones I can. And one, I would say that as an mRNA vaccine, mRNA cannot change your DNA. It's not possible. And I say it confidently. I studied genetics. mRNAs don't get into your nucleus. Your DNA is in your nucleus. So this mRNA, even when yourself, you produce mRNAs, those mRNAs are out of your nucleus to produce protein. So there is no way your genetic material is in your nucleus. So there is absolutely no way that again, there is absolutely no way an mRNA can change your DNA, because the DNA is in the nucleus and mRNA doesn't enter the nucleus. So just to put that out there, it's saying of things, and it's just not possible, and it scientifically doesn't even make sense. Now, secondly, as far as the autoimmunity, is there a possibility that that can happen? It's true, it can happen. And what's the rationale about that? If your body is going to use this template of mRNA and produce the protein, that means that there is a possibility. What if the protein that you produce shares some of the antigens that your own body cells produce, because you're the one producing this protein? And any protein you produce can have a signature that's your body. What if down the line, years from now, your body starts attacking its body, like, you know, how people get thyroid disease from autoantibodies or diabetes from autoantibodies? Is it a possibility? You know, scientifically, definitely, it is a possibility. We don't know. But I'll tell you that I, on a personal note, have taken care of more than 100 COVID-19 patients. And some people are coming back to the hospital with what we call post-COVID syndromes. And what we've realized is that some of these people who have suffered the virus, the actual viral infections, are coming in with some kind of autoimmune problems. I've seen someone come back in with what we call autoimmune thyroiditis, where the thyroid function goes off after suffering COVID. I've seen someone who's still suffering diabetes after the COVID. Are they directly related, or are they completely independent events? We don't know, but we do know that the virus has the tendency, because again, the virus has multiple proteins on it. You know, the vaccine just gives you the ability to produce one protein in the virus that it uses to cause disease. So I'd have to ask myself, if I produce the S protein that can prevent the virus from attaching, what's the difference between that and the virus itself coming in with S protein, and imagine A protein, B protein, C protein, D protein? What are the chances? So again, you know, I'm not here to campaign for the vaccine, but I do know that people have concerns, and I think ultimately people on individual basis will make their decisions on whether they want to take the vaccine or not. And I don't think anybody should criticize anyone for saying no, that they would rather wait, or for saying yes, they would go ahead, you know. And you know, if you know, let's say I've taken the vaccine, I will trust God that none of the problems will apply to me, because you and I know that two people can be exposed to the same condition. One recovers, one doesn't. So I'd have to trust God for grace. And while I do the best I can to maintain myself in good health, I'd have to understand and know that the fact that I am in good health today and I am alive is mostly dependent on the grace of God, not how careful I was, or the vaccines I took, or the medications or supplements I take. So I'll say that now, is this 666? No, I don't believe that. I believe when that time comes, for those who know about that, I believe we'll be given a choice to make, and you will know what you're choosing. Whenever that happens, track us. There are many ways that we today, your cell phone, your car, your account number, your Yahoo mail, or whatever mail you use. So this is my thoughts. Again, so it's possible 3 years from now, 5 years from now, we'll discover more things about